So some exciting allergy news. In the Annals journal in America, this is an allergy journal, Tom Casale and co-workers published a letter to the editor. This letter highlights a study where ARS, the company that make the nasal adrenaline device in America called neffy, and in Europe this will be called EURNeffy, they offered 6 of these devices to over 2,000 practitioners in the US and said, use this if you need in an acute setting in your practice. So they consider this relatively real world, albeit with a medical slant. So in America, you would use adrenaline in regular practice for immunotherapy commonly, and then in doctors who do oral immunotherapy to foods, for example, some of those patients occasionally would need an adrenaline dose. So to date, all we've had is intramuscular adrenaline, either through an auto-injector or drawn up adrenaline, which is injected into the thigh muscle. But we now have, at least in America so far, the neffy device, and soon in Europe we'll have the EURNeffy, EURNeffy. So the headline findings of this study is that 9 in 10 patients, and there were over 500 patients who required this medication, 9 in 10 responded. And so whilst 1 in 10 did not respond, we know that that is also true of intramuscular adrenaline. So adrenaline is highly effective in the setting, whether administered nasally, or if we look at other data, intramuscularly in most patients. Some patients in these studies, we suggest around 10%, do require a second dose of adrenaline. So this is very reassuring data.